Director for Health and Community Education at Piedmont Healthcare, Dr. Jane Morgan. Thank you for your time and for your expertise.
Thank you, Isabel.
So, great. What can we expect this season? And talk to me about these numbers, these cases happening in China, and whether that's of significance to us here in the U.S.
It is, and we're all interconnected in this global society. And here, what we're seeing in the United States, we really are probably cresting at our RSV, that respiratory syncytial virus, and flu is still yet to come. We have lower numbers of COVID than we were anticipating, and yet we see this mix of viruses coming in, and we want to actually be careful. When we look at China, they certainly are having a bigger surge than we are. Yeah. And part of that is probably because they came out of lockdown a little bit later. And so we see these viruses really tearing through the community. They're so highly contagious, just as we've seen in our children here in the U.S. That's also what's happening in China with a mix of viruses, bacteria, and fungi.
So that's a rebound that they're going through.
There is a rebound from so long not having exposure to all of these viruses. We actually get exposed, our children, to multiple viruses and multiple illnesses, even if they are not evident to us throughout the year. And we miss that. America had its sort of big rebound last year, and I think that's what we're seeing in China this year.
Gotcha. Well, the CDC reports on vaccines about 6% of children have gotten the new COVID-19 vaccine. So how does one make the decision of which vaccine to get and when?
What we're looking at is it's really being driven by intent. And who intends to get these vaccines and why, and what is the reason? The two primary reasons are, do the parents have trust in the medical facility and the medical establishment? And also, what is their level of concern about the viruses? We see when we look at parents and what they're expecting to do, the highest number, more than 70%, really plan to get the RSV vaccination. Next, at about 60%, we see the flu vaccination, and at 40% lagging is the COVID vaccination. And what that shows is, what is their level of concern? The highest level of concern for parents is RSV this season, followed by flu, followed by COVID. And you know what else is interesting? When we look at men, men are more likely to vaccinate their children than women.
That's fascinating.
Fascinating.
Any idea why?
Fascinating. It is an anomaly at the moment, and we're trying to take a look at why that is. But men respondents were more likely to vaccinate their children than women.
I wouldn't have thought that. But
exactly.
Interesting that RSV, of course, is the primary concern for parents.
It is this year.
Of young children. So what advice would you have for these parents as they're seeing these seemingly alarming numbers? Because there's so much advice out there. What's the one sticking point you want them to bring home?
And something that we need to remember is that even though COVID is the laggard here, it still is the primary cause for hospitalizations and deaths. And we really should not take our eye off of that, such that there is not a resurgence as these variants begin to move through and begin to change. Something else to consider as a cardiologist is we see emerging data that begins to continue to support that flu vaccinations actually decrease heart attacks by 26% and decrease cardiovascular events by 33%. And that's because there's an overall decrease in inflammation in the body and that stabilization of those plaques that can be disrupted and lead to heart attacks. So it may be that we need to begin to think of flu shots as well as part of cardiac prevention tool, as well as protecting our respiratory viruses. And so more of that to come.
So getting the flu vaccine makes your heart healthier.
Can make your heart healthier and protect you from heart attacks and heart disease.
Okay. Let's talk about masks. Are people still wearing them? What do you advise with this? Obviously, there are cultures, especially in Asia, where they would wear that anytime they're feeling a little bit down. Is that something we should be considering?
And so I don't think we're at the point of wearing masks. I think we certainly need to consider individual situations and people that you are around and whether they're vulnerable and what your behaviors have been prior to being in that situation. But currently, I don't think we're at a point where we need to wear masks, certainly not uniformly, but we always need to make certain that we keep that in our armamentarium and have situational awareness for where we are and who we are around, and have consideration not just for ourselves but for others as well.
Okay. And as you're looking ahead, as the temperatures drop, we get further into the fall and then eventually winter. What is your outlook for this season? Do you anticipate it being normal, above average?
And so I think this year we probably will have a normal to maybe slightly above normal flu season. I think we are starting to normalize. Last year we kind of had our catch-up year with all of the viruses, and we saw it really sort of tear through our communities because these viruses are highly contagious. I think this year we're really beyond that ground zero, that catch-up, and we'll see a normal flu season, maybe slightly a greater uptick as we see this confluence of RSV, flu, and COVID. And don't forget, pneumonias and things are caused by other things like mycoplasma and streptococcus. We always have to mix that in as well as we get all of our exposures back to normal.
Dr. Jane Morgan, thank you for your time, for your expertise, and it's that time of the year.
It is that time of year.
Thank you.
Thanks.